everybody, to the Pink Ribbon Roller Coaster. We're so glad you're joining us today. I have a special guest. Her name is Kaylee Ring, and she is very special to the Project 31 community. I met her years ago. Her mother is a thriver, and she brought her to her first Project 31 meeting, and it was really great to meet her. And Kaylee has been such a support to her mom and through her own journey. And now she is here with us today to talk about some dental care. I know that's a huge challenge for a lot of folks. So, Kaylee, welcome. We're so glad you're here with us today.
Thank you. I'm excited to be here with you guys.
So, tell me, which dental office are you with again?
So yeah, I am at Pragma Dental. It is located in 50 Penn Place, right across from Penn Square Mall in the heart of Oklahoma City.
Awesome. So, I know a lot of ladies who have gone through chemotherapy have some teeth challenges and dental challenges. And so, honestly, I didn't experience that. So, I don't really fully understand all of the challenges that ladies may face. Can you talk to us a little bit about some of the repercussions that might appear from chemotherapy?
Yeah, so absolutely. So, as we all know, chemotherapy really suppresses our immune system, that targets those dividing cells, and our mouth is kind of full of those type of cells. And so, one thing that we really see that's pretty common with people going through chemotherapy is just oral mucositis, where we can get sores and just a lot of pain with our gum tissue, our tongue, our cheek tissue. So that's a really common thing that we see. Another really, really common one is xerostomia, which is just dry mouth. And so our saliva is very, very protective of our teeth. And so when we start to have dry mouth and we don't have that saliva consistently throughout the day, we can start to see a lot of decay and cavities form and just destruction to the teeth. And so, especially people who are going through chemotherapy or radiation, it's going to be very important to try to stay on top of your health, your dental health, so that we can manage any of those symptoms while you're undergoing treatment.
Wow, so I didn't realize even when you do radiation, you can still have challenges with your teeth as well?
So mainly that is with head and neck radiation. So really it's when we're doing radiation that involves this area. If we're doing radiation to like the breast tissue or something like that, we typically don't have those type of symptoms, but for sure with any type of chemotherapy, since it's a systemic drug.
Okay. And what about if we're taking any kind of hormonal therapies? Could there be potential problems from that too, or no?
There can. So, with our oral cavity in our mouth, whenever our hormones start to fluctuate, we can definitely see some changes within the oral cavity. Just like when a woman gets pregnant and she starts to have those changes in hormones, we can see a lot more bleeding gum tissue. And so that's why it's going to be really important to floss. And the same thing with hormonal therapy. It's really all the same, it's all connected, and so if we can really just stay on top of it with, home care as well as coming to the dentist and getting that, routine down, we can
Mm,
really cut down on some of those symptoms that we see.
okay. So first, we talked about the symptoms. So I want to talk about first what can we do to maybe prevent some of these symptoms, and then I also want to talk about what we can do if we do have the symptoms. So let's talk about the prevention first.
For sure. So obviously, we love it when patients, already have been coming to us for their routine care. And so whenever somebody comes and say, "Hey, I just got this diagnosis, I'm about to start chemotherapy." Hopefully, we already have most of the conditions already taken care of. However, when somebody comes in, they're a new patient, they haven't been to the dentist in a while, and they've got a lot going on, that makes it a little bit more of a challenge to try to tackle everything prior to chemotherapy starting. And so really just the most important thing I can tell you is to really have a good routine care program established already with your dentist, just so that you can already be on top of things. Um, so, with home care as far as prevention, just making sure that you're flossing at least once a day, using a good fluoridated toothpaste with a soft bristled toothbrush. That's really important. And then, obviously watching your diet is really important too.
Okay, is there a specific kind of toothpaste we should be using uh, for a cancer patient? Is there anything specific that you recommend?
Yeah, so what I typically recommend for my patients, if you're just looking for something over the counter, I personally like Pronamel Sensodyne.
Okay.
I think that's a really good one to use. However, I do think it's a good idea, especially if you're experiencing dry mouth, to get on a stronger fluoridated toothpaste. And the one that I typically prescribe is Prevenant. And that is one that you have to have a prescription for that your dentist would call in and pick it up at the pharmacy.
Okay. So in terms of prevention, I'm hearing we obviously need to have an established relationship with a dental provider, making sure that we're having our routine checks and cleansings, and then we are gonna floss at home, make sure that we have an appropriate toothpaste. And if we don't have an established relationship with a dentist, can we call our oncologist to get that prescription if we need to?
For the Prevenant,
Yeah.
I do not think that they will prescribe that. Now, some may, but I really feel like you're gonna have the best luck getting it from a dentist.
Okay.
I do know that most oncologists are able to call in what we call magic mouthwash. When you have the pain and the sores associated with chemotherapy, usually they are able to prescribe that, but I haven't heard of them prescribing Prevident. But it's always a question you could ask your oncologist if they're comfortable calling that in for you.
Okay, so now let's talk about if we're going to be trying to treat some of the symptoms on the reaction side. What do we need to be doing there? You obviously mentioned the mouthwash, which we can call our oncologist about that. But what else?
But you can also call your dentist for that mouthwash too. So, uh, if you're experiencing, let's just say oral mucositis where you're having the pain and the just the sores associated with chemotherapy, unfortunately, at this time, there's not just a go-to treatment. It's really going to be getting that magic mouthwash to help relieve some of the pain and symptoms. It's not going to really take care of the problem because what the problem is that, drug that we're putting, systemically and while we're on that medication, that is unfortunately a really common side effect that we see. And it is pretty difficult to manage. Now, as far as like the dry mouth symptoms that we see often, one thing typically that we like to do for patients on especially undergoing chemotherapy is potentially upping their frequency that they come to us for cleanings so that we could help just number one, stay on top of any problems that we're seeing. So, like I said, when we have dry mouth, we can really start to get bad decay, bad cavities pretty quickly.
Mm.
And so if we can try to stay on top of that, and if we notice something, something starting, we can treat it before it turns into, that tooth needing a root canal or needing an extraction or something like that. So, potentially upping your frequency as far as coming to the dentist for your cleanings. Um, Other things that we can do to help with dry mouth, one of my favorite products is called ice chips. And what that is, you can just type it in on Google. It's just called ice chips. And it's a xylitol mint product. And they have tons of different flavors. And my mom personally used those whenever she was experiencing dry mouth. And she said it really helped her. They're very good, actually, because I've tried most of them. And so that's something that you can, suck on throughout the day just to help promote some saliva production. Biotin mouth rinse is a good one. And then another thing we can do is use those lozenges that stick to the palate of the mouth or on the cheek, just to help stimulate saliva throughout the night. Because
Okay.
obviously we can't drink, water to keep our mouth wet throughout the while we're sleeping. So that's a good one to add too.
Okay, wow, that's really good to know. So, we talked about the mouth sores, we talked about dry mouth. Now, what about I know several ladies who have finished their chemo and then they start to have the enamel break down and maybe their teeth have turned gray. What can you do for that?
Yeah, so that's another thing where, obviously chemo, like I mentioned earlier, is a systemic drug that unfortunately targets, a lot of aspects of our body, and our teeth can kind of take a beating from that. And so, after everything's done and we're not undergoing treatment, active treatment, there are definitely things that we can do to help um, build back some of that tooth structure. Obviously, we can't replace the enamel and the dentin that, was there, but we can do things to build that tooth structure back up, potentially doing some restorations like fillings, crowns, or veneers if it's, on the front teeth, just to get some of that symmetry and aesthetics back.
Okay. Is there, do you recommend bleaching or no?
Yeah, so, typically, I wouldn't recommend that if we're in active treatment, but past that, for sure. What we have is called KOR, Kor, and it's an at-home and a in-office, bleaching system. I don't love the over-the-counter, whitening systems for the most part. There are a couple out there that I'm okay with. But the reason why is those, over the counter, like whitening toothpaste or, whitening strips can really be abrasive to our teeth. And so what it's doing to whiten is to strip that outer layer of your tooth off. And that's why you're getting the whiter shade. Not all of them are like that, but we want to make sure that we're not using something that's really abrasive. Same thing as to why we recommend always using a soft bristled toothbrush. We want to avoid anything that is going to further remove the outer layer, the enamel of our tooth, and that's sometimes what that whitening does.
So the
And so
core, how does
yeah.
core work differently then?
So Core is it's a prescription strength, system that is not, near as abrasive to the tooth structure. You just can't buy it over the counter. We also we have to physically protect your gum tissue while we do the bleaching in office, because if not, your gum tissue will, it can get a little bit, not burned, but it'll be sensitive if the bleaching material touches the gum tissue. And so the results that we get are absolutely amazing. But it's just not something that you can do at home. And like I said, it's not near as abrasive as those over the counter things that you can buy.
Okay. Do you know, does insurance cover that?
Usually not, because it's considered just a cosmetic procedure. Yeah.
Okay.
I
Okay.
don't know insurances that will.
Yeah. Well, that's
I think
awesome because I was curious about that, like how you build that back up. Okay. What about, are there any other issues that you've seen from maybe your mom or other people have talked to you about that we haven't discussed?
well, one really common, um, thing that can happen with chemo is thrush.
Mm.
And so that fungal infection that you see, on the tongue, typically the tongue turns white. Sometimes the tongue can have like a burning sensation. You can get cracks around your lips from that as well. And one thing that will really help, so either your dentist or your oncologist could prescribe an antifungal for that. And then another thing that will really help is the magic mouthwash. Normally, they put in an antifungal into that concoction.
Okay. So should we upfront ask for that and just start as a preventative, start doing the mouthwash just in case, or should you wait till there's a problem to start taking that?
If it were me, I would probably wait until you are noticing some symptoms. I don't necessarily think it's good just to have that, continuously trying to prevent things from happening. I personally wouldn't do it until we're noticing, something going on.
Okay. What about I thought about something else too. You know, a lot of the, medications can cause neuropathy, and I know a lot of ladies will, suck on ice chips throughout treatment. Do you think that's a good idea?
So, yeah, I've definitely heard of that, just to help prevent some of that mucositis from forming. So yeah, if you can stand it, if you can put ice, I definitely think it wouldn't hurt. It could be just be an added benefit. I know that my mom, wore the cold mitts and the
Mhm.
cold mitts on her feet, to try to help prevent that neuropathy. So we didn't do anything as far as ice in the mouth, but I definitely think that it could be helpful.
Well, I was kinda wondering too, or you could maybe take some of those lozenges like you.
Those ice chips are just mint. They're called ice chips, but they are not, it's basically just a xylitol mint, but
Interesting.
that's
But it's
the
called
name,
an
right?
ice.
It's what it's called, an ice chip. I don't know if it's because they kinda look like shaved ice,
Okay,
when you look at the mints. I think that's why they probably called it that, but that is kinda confusing. It's not actually ice.
okay. Now what about, as we're talking about ice chips, and let's say you do have thrush or the mouth sores, could that calm it down too? Or to suck on ice, would that help, or would that make it worse?
Help with some of the just, like, the, numbing
Yeah,
of the pain. I don't think it's gonna make anything worse, and I don't really think it'll help anything as far as making it better, but it could definitely alleviate some of the, pain associated with it for sure. One
um,
other thing,
go ahead.
and a lot of times, cancer patients are put on what's called a bisphosphonate. So, an injection, typically, sometimes they're put on a pill, but a lot of times it's either a once a year or a twice a year injection, to help build back some of the bone, strength.
Mhm.
And one thing that's very, very it's not super common, but one thing that we want to, prevent with that, whenever patients are on those medications, it's called a bisphosphonate. If they have to have anything done to manipulate the bone, meaning an extraction or a dental implant placed or anything like that, we run the risk of having osteoradionecrosis of the jaw. And what that is where part of the bone of the jaw physically necroses. It essentially dies. And a lot of times it can be exposed. And so it's very, very, very important. You may think you're just going to the dentist, you're having a tooth extracted. It's not related to anything, that I've taken, even if it was in the past. It's always going to be really important to tell your provider that you were either on those medications or are on,
Okay.
because they will need to make a decision, do the benefits outweigh the risks to take this tooth out? Should we send you to an oral surgeon or potentially take a break, a drug holiday from that particular medication that you're on?
Okay. Wow,
That's a
that's
really
no, I didn't realize is that kind of like Neulasta or Herceptin or
it's
anything like.
it's not Neulasta, Boniva, um, trying to think of the Fosamax, Zometa,
Okay.
some of the common names of those.
Okay, so if we are taking that or have taken that, we need to make sure that we communicate that to our dentist.
Yes.
Okay,
Even
that's
if it was even if it was in the past.
okay.
And a lot of times you're not thinking about it, like, "Oh, I had that injection 6 months ago."
Yeah.
It's no big deal, but it is a big deal, and you need to tell your provider about that because it will affect, especially if you're doing, like I said, something that is manipulating the bone,
Mhm.
taking it out you doing an extraction or like a dental implant.
Okay. Wow, that is very good to know. Well, is there anything else that you feel like we need to address that we haven't talked about?
Uh, you know, My thing is you can never over communicate, number 1, with your oncologist, and then 2, with your any provider that you're seeing, but with the dentist too. And so it's always helpful for us if you can kinda give us your full history, and then I would personally like to call or send a medical clearance to your oncologist, so just so that we're all on the same page. We're not doing anything that is going to hinder your cancer treatment or anything like that. So just always be over communicate with your provider so that we can provide you guys with the best service that we can.
Okay, awesome. Well, thank you so much, Kaylee. I appreciate you coming on and talking to us, and I hope and pray that this information is going to be helpful to the ladies, and I think it will be. But ladies, if you guys have any questions that we didn't address that you'd like Kaylee to answer, feel free to email us at info@project31.com, and I will get that to Kaylee, and I'm sure she'll be happy to help us and give us any more insight that she has to offer. So thank you again for being with us today, and
Uh,
hopefully you'll come on again soon.
yeah, thank you for having me.